Welcome to Good Sex at NYU, a podcast about sex, relationships, health, and mental health in a sex-positive space. So if you're looking for something serious, sometimes funny, and always sex-positive, then you're in the right place. I'm Danielle Elliman. I use she/her pronouns, and I'm the Associate Director of Sexual and Relationship Respect Services. This is Good Sex at NYU, your space for sex-positive conversations about relationships, sex, and well-being. Thanks for joining us. Welcome to Good Sex at NYU. I'm Danielle Elliman. I am here with my co-host for today, Adna Hyde. Welcome to the podcast. She is a first-year grad student in Steinhardt's Counseling and Mental Health and Wellness program. So welcome to the podcast. We're in conversation today with Dr. Ji-Yoon Lee and Dr. Reggie Mathew. Some listeners might recognize Dr. Matthews from season 2, episode 14, where we explore harnessing our emotional intelligence, and episode 20, where we talk about making sex accessible. So I encourage you all to check those episodes out.
We are so happy to have you both here today to talk about attention deficit hyperactivity disorder. First, can you share with our listeners your experience, your background in working with people who experience ADHD?
Yeah, I can start with, I appreciate your invitation to talk about like ADHD. It is so popular kind of topic everywhere now. I'm a licensed psychologist, and I started my journey in this field with ADHD when I was in my APA accredited combined PhD program in counseling psych and school psych at Florida State University 2 decades ago. It's a long time, I feel like. And as a doctoral student in combined program in counseling psych and school psych, I took a school psychology classes, including intro to school psychology class, and which is a foundation of neuropsychological, neurodevelopmental disorders, including ADHD and learning disability. And I chose to complete the assessment track. And so I complete the intellectual assessment and psychoeducational assessment for ADHD, LD, and other neurodevelopmental disorders. And also, I completed the ADHD coaching practicum in my program, which was running by other learning evaluation center. Now is Assessment, Learning Evaluation, and Counseling Center, which was run by the clinic department at Florida State. And because of my advisor, Dr. Francis Privet, in my doctoral program, developed a scale for pre-screening tool of ADHD, which called assessment academic success inventory for college students. So I was involved in the research team and complete my dissertation too of a cross-cultural validation study of this instrument in Korean translation version. So after completion of degree, I continued, working in the ADHD field as a ADHD LD testing provider in a university counseling center in Akron, Ohio for 4 years. And, I came to New York, and at the counseling center, we have a ADHD team. And for the past 5 years at the Counseling and Wellness Services, I have been serving as a ADHD co-leader of the team. Here, we have Dr. Reggie Mathew as a team member, while providing ADHD individual coaching, ADHD coaching workshops, and ADHD coaching group in SHC Brooklyn campus. So I have exposed to many areas.
Yeah, you have so much experience. That's amazing.
Yeah.
Yeah, it's an honor to be here with Dr. Lee. She is an expert in the world of ADHD, in clinical and teaching and in research. So it's great to be with her. But I'm here as a supporting cast member. My area of expertise is in skill-based therapies, and I'm teaching emotional regulation, self-regulation, what we talked about in our previous podcast. So orienting towards helping people to become skillful through the cognitive behavioral therapies really lends itself to the world of ADHD.
Mm-hmm.
So I've joined as a team member at the clinic.
Yeah. You both have so much experience. So I so appreciate you both being here to help us learn more about ADHD. I work with a number of students who, will come into my office and sometimes either self-diagnose or diagnose through social media that they have ADHD. And so I'm wondering if, you can tell us just some basic stuff. Because again, I think there's a lot of great information and maybe some not so great information that's out there. So if you could share with us just some basic symptoms, basic things to think about when someone is potentially curious about, seeking further diagnoses of ADHD.
Yeah, this is a great question. So I can share about what ADHD is. So ADHD is the acronym of the attention deficit hyperactivity disorder. So which is defined by the American Psychiatric Association in most recent version is the DSM-5-TR text to revision of Diagnostics and Statistical Manual is published in 2022. So many people have ADHD because they have a like concentration issue. It's hard to focus. It's for easily forgetting things. But ADHD is actually three different types of subtypes, and there are different symptoms of it. It's a neurodevelopmental disorder, indicating that it's the persistent pattern of inattention or hyperactivity, impulsivity that interfere with functioning or development. So that should happen, the age onset is before age 12. So the symptoms of ADHD is in children is while exhibiting any distractedness or impulsivity, fidgeting, restless, and commonly slow, jiggling their feet and tapping their fingers and constantly changing their body. And because of a lack of concentration, behavior, self-control, children with ADHD are more unable to learn effectively and can also disturb their teachers and their classmates. And so ADHD is not happening at school or at home or relationships, at least like two different settings that should happen. And they often show like poor social skills and which are not tolerated in the group of activities. So they may be rejected by the peers. But by the later childhood, the pattern of conflict in their academic and family social relationship have a well established. So it open report that many children with ADHD become developing oppositional defiant disorder or any behavioral kind of issues with the conduct disorder. So in general, consistency in the ADHD symptom remains well into young adulthood. Like college students, so we see in our office included, and 2/3 of them, has their childhood diagnosis with ADHD. So it's a more kind of chronic condition. But some researchers report that individuals with ADHD mature out with a hyperactivity and impulsivity, while individuals experience the inner restlessness and inability to relax or excessive talkativeness. So you can see that people, can experiencing more about quiet ADHD, not showing appear outside of them. But the inattention in adulthood often present distractibility, disorganization, being late, being bored, or need for variation or difficulty making decisions, lack of overview, or sensitivity to distress. So especially college students with ADHD have difficulties with completing their homework or significant lower GPA or withdrawal from the courses more frequently and less likely to graduate from college. And it might impact their employment with a poor work record or lower job status and reduce the probability of employment, which results in the more frequent change in their jobs, lower economic status, and negative impact of quality life. So, like I can see in my office, the students that have these issues and academics, relationship, overall employment, life managing, or overall mental health concern because of the ADHD symptom we call like comorbidity. So they might have other symptoms like depression and anxiety because of, frequent like frustration of their life and their dissatisfaction with their work and life itself.
Yeah.
So yeah, researchers also shown that adults with ADHD have more problems with the friendship and relationship. We're gonna talk more about it
Yeah.
later on, with others, including maintaining long-term relationship, with resulting feeling more lonely and less satisfying with their social network. So adult with ADHD can have difficulties in understanding social cues. So it can be perceived by others as lewd and insensitive. In my group in person in Brooklyn, I have a 1 week session focused on social relationship and how to read the cues,
Mm.
how to kind of interpret that other people's nonverbal signals and cues to make a kind of proper relationship with
Mhm.
other people and handle their conflict if they arise.
Yeah, I have a follow-up question, and maybe this is something that you were going to get to.
Mm,
One of the things that I have heard, and sometimes again on social media or with my clients, that that there might be differences within different communities on how ADHD is diagnosed. For
mm,
instance, sometimes I've heard that female identifying folks are like sometimes missed the symptoms or missed the signs, and they
mm,
are delayed diagnosis.
mm.
I'm wondering if other communities also have differences, or if you see that there are any kind of things that jump out to you either in the research or in your own personal experience on how ADHD might show up in different communities.
Oh, yeah. So that's such a great question. And when I just overview those prevalence of ADHD, I also talk about like gender differences. I usually in the group members talk about, how about girls versus boys or male versus the females like that. And so it is the 1 to 2 ratio. And boys and girls or in childhood, they have more boys, so 1 to 2 ratio. So because I guess that the hyperactivity or impulsivity symptoms of the boy side is I do not want to overgeneralize it, and so more girl side is what is that more talkativeness because of socially um, or learned about behaviors in the expected behavior as gender based in our society. And so definitely there are showing more kind of inattentiveness in girls or more talkativeness as a hyperactivity or impulsivity kind of symptoms of ADHD. When they become an adult, it is the 1 to 1.6 ratio, but more like males than female. Is the same about like those hyperactivity and impulsivity symptoms has a little bit like maturing out and showing or manageable, but still there are inattentiveness is still remains, and so there are gender differences. And in terms of different cultural diversity, because I did my dissertation kind of data collection in Korea. At the time it was like 20, 29, 20, 28, 29 around the time like before 2010. And so ADHD has not like I don't know popular right at the time that people does not know about how to uh name ADHD, how to call ADHD, how it looks like ADHD symptom in children and adolescents and adult. So now because of pandemic and everyone knows about what ADHD looks like, and social media talk about ADHD, so more we have a higher awareness. So they are very low, and I collected my data like 1,000 college students, only 5 students or among those populations, I guess the 0.0005 or something is diagnosed with ADHD already. But in the US sample, it's about like 5% of population, I believe,
Mm.
or 8 point some point of adult population with the ADHD. So it's way lower in different culture and countries, I believe that, because of the awareness level or the system of diagnosing in the health system, I believe that.
Oh, great. Thank you.
Yeah, thank you for sharing that about the cultural differences and especially the gender differences, both in the US and outside of the US.
Mm.
What are some of the recommendations for treatment and treatment barriers?
Yeah. So anything you want to add before I jump in, Reggie, about
Yeah,
prevention?
thank you, Dr. Lee. The scope of your research understanding on this topic is so invaluable to this discussion. Um, I just want to maybe you asked a few different questions.
Mm.
You said the treatment barriers, treatment options, and the treatment skills. Is that what I heard
Yes, the
in your
recommendations,
question?
yes.
Yeah. So I want to maybe address the treatment barriers, if that's one question. Um, what I've come across when I meet with people that are newly diagnosed or early diagnosed or come from cultural backgrounds where this wasn't part of the vocabulary, seeking mental health, also ADHD initially is an invisible condition, that there's a lot of internalized ableism or stigma in terms of how their particular brain works. So the what we really want to encourage people is that the world that we're all working towards is a neurodiverse future. That means that a, div- a diversity of brains and bodies can move through the world in their particular way. That we all move through the world in our unique way towards the same outcome. So I guess in terms of barriers, there's cultural stigma, there's misinformation, there's internalized ableism, meaning that there's this I a lot I've had a lot of students say, well, why can't I do it like all the other students in the class? Why can't I do that? What's wrong with me? And that's where we want to help people to move towards, to notice that just like there's diversity in the ecological world, there's diversities in the ways brains process information, complete tasks, execute tasks, and move through them. And that's why the wonderful thing about ADHD treatment and coaching is there's a wide range of skills, tools, sensibilities, ways to structure your day that can honor the way your brain processes information and moves through the world. So I guess with barriers, there's cultural, systemic, sometimes financial barriers in people accessing early diagnosis and treatment. But what I see here often when I meet the students first time, there's a lot of internalized ableism to say that,
Mm.
what's wrong with me versus accepting a neurodiverse perspective to say, okay, I have a unique way of moving through the world. Let me understand what that way is and build a skill set around it.
Mm. Yeah, I think those are helpful. I mean, can you talk a little bit more about some of the financial issues? Because I think this comes up. I mean, once someone has like moved through maybe some of the cultural barriers or some of the stigma, there really is some potential like financial and just access to services and treatment. Can you talk a little bit more about that barrier?
Well, here at the clinic, we have a pretty solid ADHD team where the two leaders have gone to great lengths to provide an extensive resource list of ADHD trained clinicians, but also testing resources. So we have in-network, we have out-of-network resources. So we do go to great lengths to try to make sure that the students here on campus would have access to the care that they need. But what we often find is, but by the time they get to us, they may not have had access in their particular cultural context. So that's the one thing we'd want to really educate people here is wherever you're starting when you come here to NYU, whether this is the first time you're naming this and seeking an evaluation, or you grew up in a culture where testing and evaluation was normative, we will meet you where you are, and work with you to try to get your needs met.
Thank you.
Yeah, I mean, that's a great point. And, I'd like to add that financial cost of it, because medication treatment is of the ADHD is very common. So it's a pharmacotherapy, like taking medication is like the crucial part. I believe that is a common treatment of ADHD in children and adolescents as a, chronic condition. And it stays in their treatment plan, like for the, I don't know, like rest of their life, right?
Mhm.
Since they got diagnosed with ADHD, probably it is the neuropsychological testing. It costs like, a few $1,000s, or in New York City too, it is a very expensive or like very costly, like, comprehensive testing. It can cover by the insurance though. So and that is needed to maintain those medication treatment. That is a positive effect, definitely benefit to when one of the medication of ADHD is to improve their focus. And so there is like a misconception of it too, because it is the kind of magic pill or study pill, or you can focus on better, but more easily work on things and study, and like candlelight effect. And so when you use the candlelight to read a book, and you can focus, but it's very dim, right? So you can have a LED light bulb, for example, and that's so bright. That's happening for individuals with the ADHD brain. So that is very helpful, but that should be remains in their treatment. That costs money, or it is like short acting. There is a medication like methylphenidate or amphetamine or different formulas, but not everyone is responding to the medication as a responder, we call, but non-responder. So about like half of them have side effects, or so it doesn't work to reduce their symptoms. So they need to seek other types of comprehensive treatment plan, including psychotherapy to improve their executive functioning or self-monitoring skills, and like skills and strategy, and also individual coaching for improving their academic skills like time management, or kind of work with the procrastination issue or motivation, and also other things like so social skills, for example, like ADHD coaching groups. And there are different modality of services, but that medication can be um, yeah costly. Like you need to pay for that. It's hard to access it. So during the pandemic, there is a ADHD shortage, like a medication shortage, because it's over-diagnosing, or everyone is kind of seeking or medication treatment for better functioning of like ADHD symptom. It can be the concentration issue. So that is definitely make other ones with the real ADHD symptoms have no access to the medication treatment. So it is like a very the medication provider follow by kind of strict or very conservative guideline for giving out like prescribed stimulant for individuals with the ADHD symptoms. Yeah. So.
And can a general like doctor or a psychiatrist provide these prescriptions? How is everyone getting access to all of this during the pandemic? I'm just kind of curious.
Yeah, so I believe that comprehensive testing, for the confirmed diagnosis with ADHD, it is so crucial. So after getting those confirmed diagnoses by, school psychologists, neuropsychologists, and clinical psychologists, or who train those ADHD testing, and get those diagnoses, and go to the the prescriber for medication, or psychiatric department, or it can be done by the mental health psychiatric provider, and also nurse practitioners, but to prevent individuals from the over diagnosing those ADHD, is highly recommended. So, and then it can be from their previous provider, like pediatrician, for example, and then they need to renew those, or renew their renew their confirmed diagnosis. Like some providers request it, some providers from other state, providing, updating kind of confirmed diagnosis with that. And so it depends on the providers, like what is that attitude, or like how conservative they are approaching to providing medications. And I think that we have our guidelines, to providing treating the individuals with ADHD, students with ADHD at the counseling center. So we are following those guidelines. Yeah.
Yeah, thank you. I was just curious. I was thinking it was not great that folks who needed the medication back in the pandemic weren't able to access it. It was like, how was everyone getting this diagnosis so quickly? So I appreciate you further providing me with additional follow-up on that.
And what are some of the skills that folks experience ADHD might benefit from learning, especially when it comes to their academic pursuits?
Mm. Yeah. So, in my what is the ADHD groups or ADHD coaching groups, I use this modality to improve their executive functioning skills, and focusing on, like, there are very common topics, and we all kind of ADHD team, like including Dr. Mathew, time management, goal setting, and prioritization, or what is the most important for skills, like what is the priority for your life, for your academics, and stress management. So offer those, like, psychoeducation, the insight into the difficulties in specific academic areas, and also improve very specific kind of skills to improve, how to manage your time better. I mean, I use personal kind of time management assessment. What is the kind of areas of focus, or what is their strength. And so, for example, including developing their, like, daily routine, or how to manage their sleep quality at night, or how to maintain their overall routine based upon their priority, like that. So that's, I'm using different techniques and skills in these academic areas. It is very it is it's very various topics in this, how to improve the um, you know academic skills in different areas. So I sometimes refer the students to go to tutoring center, for example, university learning center, or student success center, to focus on academic skills in general. Like, yeah. So anything that you do.
Yeah, in addition to the executive functioning skill set that's taught with ADHD coaching, what I find is also helpful is to address the secondary stress that comes in acquiring these skills. So the stress management that you need to be able to have the patience to develop this coping blueprint, and also the anxiety, when you're finding your way to get to the same endpoint, but through a different path. There's a lot of comparison. There's a lot of compare and despair. There's a lot of judgments at times. So cultivating an inner relationship with yourself of compassion, curiosity, and also what's called constructive discomfort. There's a little bit of there's a little bit of a journey here to figure out that blueprint is, in a way that I can move through the world, reach the same endpoints, but in my particular way. So those are some of the skills that we would add to the ADHD skill set.
Yeah. Thank you. I'm curious, and this is kind of off the cuff, and so forgive me if this is something that you don't feel like you can answer, but I think that, like, time management comes up so often when folks think that they may have ADHD and maybe they don't. Can you give us maybe, again, sometimes this is also very deeply personal to each individual student, but what might be some skills, excuse me, what might be some skills that you could recommend for someone who is struggling with time management, just in general? Because I think that, again, a little bit of a universal thing for folks, but also directly for folks with ADHD. Like, what would be a skill, or how would you approach that?
Yeah, so I usually typical, like, three different things I would like to highlight it. First is I'm asking about the first question. Do you have a planner? Like, kind of physical planner? Do you use it as a kind of Google Calendar or the electronic version? If they do not have any of that, that is the baseline. Like,
Mm.
so how to use the calendar, how to use the planner, and to prioritize their goals. So for example, academic semester, they have different deadlines and different what is the project? It's something is like quizzes every week, or it's more a long-term project, write a thesis or dissertation. So you need to have a like game plan for that,
Mhm.
backtracking of how to tackle it, to put into their smaller goal to achieve, and break it down to the monthly, weekly, daily objectives. It is like based upon their 24-hour log. We also use it to break it down into very smaller goals, then put it into your actual calendar for that day, and check it out, and tackle each task. And someone have a hard time to start a task, and then I encourage them to use like Pomodoro technique, and at least do not use any kind of do not use any electronics, or just focus on the task within the time frame for the Pomodoro technique. And based upon that, there is a kind of theory behind it, or kind of frame behind it. The second one is the Eisenhower time metrics, or time management metrics we called. So based upon how urgent the task is, how important the task is. Individuals with ADHD or without ADHD have a hard time to differentiate what is the task is urgent or important, or not urgent or important,
Mm.
or important but is not urgent. Those kind of things, and four quadrant or four areas. So, individuals with the ADHD have all kind of urgent issue, right? Everything is like tomorrow, like 2 hours later, like I have a deadline. I can't start or something like that. They call. So kind of to have a blocking their time, to plan out in the end of the week or in the beginning of the week, have those blocking time to overview. Is that metacognition, right? Overview of how long does it take to complete those tasks, and how long, what time I am available within my schedule for the week, and then put it into the calendar. That is using, kind of quadrant two, or it is not important, but it is important but not urgent. So if you do not have those blocking time, your me time, planning time, or prevention time, it is like handled by the time is overwhelmed by the urgent tasks and or interruptions, especially individuals with the ADHD symptoms. Is a hard time to kind of tackle those interruptions. Is constantly kind of getting easily distracted by the disruptions or distractions. So, and to identify or label, or what is my distractions? How can I block the time to focus on the study, or managing those time, uh, kind of overall the week, and then review it to plan the next week. That is the kind of system they need to develop. I believe that, yeah.
Yeah, thank you. Can you come and organize my life? Because I
Mhm.
feel like that would be really helpful. But Reggie, I'm wondering if you can share with us maybe like a recommended like stress management skill that like, because maybe even just buying the calendar, or, thinking about doing the calendar might be stressful for a
Yeah,
student who has
I love
ADHD.
what Dr. Lee just
Yeah.
outlined here, because it's based on the principle that you have to structure the day to structure your mind.
Hmm.
People, it's called activation versus motivation. The more that you structure the day, it gives the brain a signal to say, okay, this is next.
Mm.
Pause, slow down. The other skill that's come up a lot recently in my coaching sessions is the whole issue of digital health.
Mm.
I really feel for the student of this moment, because what is demanding their attention is so vast and so broad. We have multiple forums. So a basic principle in digital health is that any digital tool, whether it's texting, the phone, email, voicemail, Zoom, whatever form, it's a different world that we're living in. So to have a framework for that, say when is the digital world a trigger? That means we engage with it and throws us off. When is the digital world a stressor? That means, you know what? Do I really need to have 60 notifications on the phones sending to me every day that's not relevant to my day? And when is the digital world a resource? Puppies and kittens. I need to check in with all my favorite animal instant celebrities every day. So to be able to regulate our relationship with the digital world, I found to be a very critical tool in knowing where the attention is for our mind, what kind of energy that we give our mind's attention to, and also boundaries. That's a hard thing to think about, to say that, to achieve goals, you also need to slow down, set boundaries, turn the phone off. So we're living in a world where things don't turn off, especially in New York City. So I really think that digital health and evaluating your relationship to digital health, say where is the boundary where it's a trigger, where is the boundary where it's a stressor, and when is the boundary where it's a resource, and what time of the day can you engage with it in a way that it's helpful to you.
Yeah, I love that.
Awesome. Thank you for sharing that with us. How might experience ADHD impact relationships and dating, and what are some of the skills that might help folks recenter?
Yeah, you want me to start, Reggie? Or yeah. So I appreciate that question, because many adults with the ADHD experience lifetime, um, you know, la like lifetime conflict issue, or kind of having frequent highs and lows and mood swings, and short focus, the temper outburst. And so people have difficult times with, irritation or disruption to others, that because of the short temper of individuals with the ADHD. So some partners report that those with ADHD have a low frustration tolerance, and tend to anger easily. So, this is the high co-occurrence of depression with ADHD, can also strain the social relationship. So, research shows that, ADHD and marriage, that higher rate of getting married is not different for those with ADHD, but individuals with ADHD report lower satisfaction with their marriage. And there is also evidence to that separation and divorce rate are higher. And so in general, although with ADHD feel they get angry more easily, have temper outbursts, and break up relationship with the trivial matters. So I believe that it is very important to know about, to like social skills, social relationship, like how to communicate with others when I'm not feeling well. So naming those feeling, or labeling those feeling with their own words, and communicate with the other people. And when they have and individuals with having the anger outburst, and so how to de-escalate those tension, or the anger, the temper, and like it can be count, 10, or count 5, or slow down, or take their own time, and coming back to the conversation in the relationship. And also how to resolve the conflict sometimes, and so how to express their emotions when they kind of rise that conflict, how they can resolve it, and how to maintain more kind of long-term relationship. And it is like kind of same thing, like celebrating, good things or anniversaries, and sending those emails. But individuals with ADHD may forgot to contact other people, or kind of message others is on a regular basis. so how to maintain more long-term relationship. So there are many strategies like that. And so, like I said, in my groups and to how to read other people's nonverbal cues and what is the posture of open communication to other people, not like closed-minded, like cross their arms like that. Have a personal space in between people, and it's like counseling psychology 101 or mental health counseling 101. We have those skills to talk to other people, right? And so share them in the group.
What I want to say is that if you're listening to this podcast and if you think you have ADHD and you're thinking about dating, kudos to you. That's really important. So let's really remember that we all are full people. Yeah, we're holistic people. We have all the same needs and desires. But the key is similar to a podcast we spoke about last time, Danielle, is that know who you are and know your process. The more you set the tone and you're able to inform the other people how you move through the world, I feel like that really brings the stress level down. So, for example, if you're someone that really struggles with time, communicate to say, you know what, I may be late. It's not intended. I just need you to know that about me, right? And I'm working on it.
Mhm.
So I also like the idea of expectation management. The more you're clear about what someone can expect from you and how you go about delivering it, whether you can, you can't, or you're working on it, I think really makes things transparent. So be honest and know that whoever you're dating has their own set of challenges as well. So I want to go back to this idea that we talked about self-acceptance, self-compassion. The more you set the tone and that you're in charge of your challenges, vulnerabilities, strengths, and weaknesses, that guides the other person to know how to be with you.
Yeah, I think that's really important for anyone in a relationship. Like we've talked about Dr. Mathew in our former podcast, that knowing who you are and allowing someone to be both emotionally and intellectually intimate with you. So it's like, how does my brain work? And not having the shame that can sometimes be connected with various different ways in which we process things. So I really appreciate that. I'm curious, I've heard, and again, sometimes I get this information from students or from social media. I can't remember where this came from. But I also think that I've heard that people who experience ADHD might also have like more high risk behaviors or can engage in high risk behaviors. Does that show up in your work? And does that sometimes show up? I mean, I'm assuming it would show up in relationships, how they might engage in different types of, sexual activity and or with, substance use. Does that come up in the work that you see as well? Or is that true, I guess?
Oh, yeah, definitely. So, in like I kind of said, in the comorbidity, individuals with ADHD have a higher chance to have other comorbidity, like including that is depression, anxiety, or sometimes a substance use issue. And so definitely it is medication is psychologically like addictive, I believe that, and someone have a misuse, and definitely that impact their life in general, like, yeah. So focusing on what is that, how ADHD symptom impact their other lives, including other comorbidity issues like anxiety, depression, or anger outbursts, like behavior issues, or their relationships, or academic concerns. And so, like, to overview of their overall like mental health issues and their life functioning is so important. So I'd like to maybe next questions, but we have as a therapist at the counseling center, we offer all individual counseling short term. But when we are asking, we do ADHD team also offer those counseling intake for individuals for the because of the referral. But we all ask this question about overall, how they are doing, what type of symptoms they experience, any substance use issues are related to ADHD symptoms. and any other like depression or more severe risk issue like that. Yeah, definitely.
Thank you. I know that was kind of thrown at you. I think I'm using both of you as my individual supervision for folks who experience ADHD that I see. So I appreciate you being willing to answer some of those like more specific questions for me. I know that we're about out of time, so I want to get to our next question.
Yeah, you briefly mentioned a little bit about the Student Health Center and some of the resources there. What are some other resources you might recommend for those who think they have ADHD and for those who have been diagnosed with ADHD?
Yeah, so I'd like to highlight, and you can add Dr. Mathew. And we have ADHD team. I can see this. I couldn't see this team anywhere else. It is very. I'm so privileged. I think then we have a team and with a clinician who have a specialty and clinical background and educational background like that. So we offer individual coaching and so it is up to 4 sessions and it's referred by the individual counselors or their psychiatric provider within counseling center. So anyone who wants to or kind of with the ADHD diagnosis kind of utilize these services, definitely we offer officially up to 4 sessions, individual coaching sessions with the ADHD team provider, and also we have ADHD coaching group in person now in Brooklyn campus at Tandon School of Engineering, and also Washington Square, I believe that is running 2 groups. That's great. The student kind of enjoy the group and coming to group talk about something that they cannot talk about outside of the group, or they feel so connected. And so someone like me and someone like having some issue, I feel free to talk about that in the group space. And so students gave me some feedback in the group that is the only place I can talk about ADHD or something like that safely. Yeah.
Mhm. Yeah, and in the individual coaching, we can work in a very prescriptive way to each student and guide them to tools that could be helpful. Like, for example, I love FocusMate, which is virtual co-working with another student if you feel like you need the anchor of a scheduled study session with another person. And there are a lot, this is where the use of digital tools can be helpful. There are a lot of, I really like Notion. As an NYU student, you should be able to get a free NYU ED account. There's a lot of workshops in NYU Digital on how to use tools in a way that can help you to study and process and metabolize information. So there are a lot of tools out there.
Yeah, and just to clarify, is individual coaching different than individual counseling and the short-term counseling at the Student Health Center?
Yeah, definitely. So individual counseling is psychotherapy. It's the short term is most likely bi-weekly. So through during the individual uh counseling intake session, we are gathering information about, in general, for everyone, who are enrolled for classes at NYU. And we are talking about what is the presenting concern. It's like, in general, like depression, anxiety, or stress, relationship, other concerns. And also one of the question is the ADHD and symptoms. But and then they are moving forward with the follow-up, counseling sessions. But coaching is complementary. So it is more skill-based and focus on different coaching topics, and including like time management, goal setting, procrastinations, and other can be stress management or some sort of other kind of skill-based, focused skill session, individual one-on-one with the ADHD team. So which is slightly different, from psychotherapy. Yeah, so that is the differences, definitely.
Yeah, thank you. I just wanted to clarify because I know it can sometimes be confusing. It's in addition to like the individual short-term counseling, and it's limited on who can access that and who can and how many times that they're like seen for an individual ADHD coaching, correct? Okay. And are there other resources off campus that you can recommend for students? Or I know you mentioned earlier, this is on campus, but like a tutoring program that you often recommend folks to, are there other things that are sort of outside the counseling and wellness services that you recommend often to students?
Yeah, so off campus, if they kind of use the individual coaching service, there are ADHD coaching directories, I believe that, which is provided by the professional organization. So there are like ADHD coaches or psychologists or with the other credentials, providing ADHD coaching services. I believe that that can be searched by ADHD coaching directories in the specific organization. I believe that is a one. Yeah, and off campus, there are coaching groups and some other group what is that, therapy centers, or they offer, usually they are offering the neuropsychological testing and also providing those coaching group or other social skills group. So the resources is out there. So when someone is interested in off campus, and definitely we can offer those referral resources. And I think Wellness Exchange, they have a case manager, so who can offer those referral resources. Yeah.
Great. Was there anything else that we missed in the conversation that you would like our listeners to know about or hear about?
Yeah, and I'd like to one thing highlight that academic accommodation piece. And so when someone is diagnosed with ADHD, and they can register for or apply for the academic accommodation through the Moses Center. So when they are in high school or elementary school, that is provided by school. But when someone is in college and with the ADHD symptom, it is not offered automatically like that with the IEP. It is not there. So I really encourage the students to advocate themselves to seek resources, including academic accommodation. So for through the Moses Center, and also through us, like psychological resources, services, ADHD coaching groups like psychotherapy and other psychoeducation or workshop, and that's great. And we have all resources that we can offer. Yeah.
Yeah, we have a lot of wonderful resources, including the two of you. So thank you so much for joining us. I think this has been a really helpful conversation for me. So I hope that others get some things out of it as well. So thank you so much.
Thank you.
Thank you so much.
Questions or feedback? Email us at goodsex.podcast@nyu.edu. We typically respond within 3 to 4 business days. We know we can't cover everything in one episode, so if we missed something, got something wrong, or something didn't sit right with you, we'd love to hear from you. Check out our show notes for links to books, organizations, or other resources. If you have questions about your sexual health and you're an NYU student, you can reach out to our sexpert at sexpert@nyu.edu or book an appointment through the Student Health Center portal. If you're facing an urgent mental health or safety concern, NYU's Confidential Wellness Exchange is available 24/7 at 212-443-9999 via their app or wellness.exchange@nyu.edu. For non-NYU listeners, you could call the National Sexual Assault Hotline at 1-800-656-4673 or the National Domestic Violence Hotline at 1-800-799-7233. Tune in next time, and don't forget to subscribe for more Good Sex at NYU.